We spend a third of our lives sleeping. Sleep is so important and vital for our physical health, emotional health, mental health, and lack of sleep or less sleep or poor sleep impacts our daily functioning. About a half of the US population has a problem with sleep over the course of their lifespan. Half of the US population. I mean, this is a very, very common problem. In doctors' offices, often sleep disturbances are not well identified. Doctors don't ask a lot about sleep. Patients who come to doctors' offices often don't talk about sleep. It's sort of a silent epidemic, if you will. And that's why sleep centers such as ours are so important. We specialize in the identification of sleep disorders and the treatment of sleep disorders as well. We focus on sleep and sleep only.
Hi, good afternoon. Do you have an appointment today? Yes.
The Jefferson Sleep Disorders Center is part of Thomas Jefferson University, one of the oldest academic medical institutions in this country. And for that reason, many of our medical faculty are extraordinarily well known in their field and considered experts in what they do. People come to us with a variety of types of symptoms. For example, daytime sleepiness, lethargy, not being able to stay awake during the day or feeling run down, fatigued. They may not be thinking clearly, focusing, or concentrating. Or people complain of insomnia, not being able to fall asleep or stay asleep. They also complain of various things that happen to them while they're asleep. Snoring, unusual movement disorders like periodic limb movements in sleep. Prior to your visit, you'll actually complete a questionnaire, and we get a lot of information about you before you even step in the door. Once you do come here, you'll see one of our medical practitioners. We'll ask you lots of questions, get a lot of information from you about your physical health, mental health, and sleep health.
When you sleep on your back, there is no air going to your body, and that's when you wake up to open the airways.
Okay, is that why that's the part of the snoring?
Right.
Okay.
We might do a physical examination. We might ask you to get some tests, blood tests possibly,
See your heart ballot.
or even sleep laboratory tests in our state-of-the-art sleep laboratory here on site.
Please have a seat in the chair.
All right, thank you.
When patient comes in the evening, they usually have a setup, meaning they have a lot of EEG stickers on their heads, a couple of belts to see how your chest is moving or your belly is moving.
Now, you don't have to stay on your back for this entire time. All right?
The data that coming from those sensors, it comes in the form of squiggly lines. We're looking for the breathing, interruptions in breathing, stages of sleep, and the technician will be seeing this and interpreting this, putting marks during the night.
We have a number of other different kinds of tests which could be done outside of the sleep laboratory. It could be done at home. We have home testing as well. Not only do we have sleep medicine experts or specialists, we also have medical faculty and staff in various other disciplines: pulmonary medicine, psychiatry, neurology, dentistry. All of these are important facets of sleep medicine. We rely on this multidisciplinary professional staff to complete our evaluation. We are sleep detectives. We look at these complaints and then identify the underlying specific disorder.
Just snoring, people saying that I'm too loud, I'm waking them up. So.
A lot of what we do is simple listening. We listen to our patients. We give them enough time to talk about their problems.
You never heard yourself snoring?
I never heard myself snore, other people.
People come in to see us after they've been on all sorts of treatments. Sleeping pills, which may not be that great for their health. Various medications, which may not be that effective. But the doctor forgot to look at the problem behind the symptom. Once we've identified the problem, we'll recommend a variety of treatments for you. We might recommend continuous positive airway pressure, or CPAP, for your sleep apnea.
This is our most popular one that patients like.
We might recommend dental appliances. We might recommend weight loss or medication. We have specific medications for specific problems.
That looks easy.
Rather than resorting to symptomatic management or managing the symptom, we identify the disorder and treat the disorder. Most of our patients do better after they leave the program. In fact, many patients have a complete resolution of their symptoms. They leave without any of the problems that they came in with. And those changes often occur fairly rapidly within the first few weeks or few months of treatment. I like the field a lot because I can produce quick changes which benefit people. We have a lot of happy patients.